And let's bring in Dr. Aditi Nerurkar for more. Dr. Nerurkar is a physician at Harvard Medical School. Doctor, good morning. Thank you so much for joining us. Let's start by talking about a new report that shows COVID-19 as the #1 cause of death for police officers since the pandemic began. Pretty surprising thing, I think, for a lot of people to read. According to this report, 5 times as many officers died from the virus compared to gun-related deaths. Do we know if this is directly the result of low vaccination rates among officers? And big picture, does this pose a risk to people who might come into contact with police officers?
You know, this is a very concerning trend that we're seeing, Ellison. Like you said, COVID is now the leading cause of death among police officers for 2 years running in 2020 and 2021. This is mostly due to 2 reasons. The first is that vaccination rates are abysmally low amongst police forces, some of the lowest among professions. And the second is because there's a rampant sense of misinformation. There's a culture of disinformation and misinformation within police forces, police unions. So we really need to do so much more to educate on the benefits of the vaccine. And like you said, police officers are frontline workers. So they are putting themselves in danger when they are not fully vaccinated. Likewise, they're putting other citizens in danger. So we do need to work on this very promptly.
And Doctor, I want to now ask you about the booster shots and this idea of mixing and matching. As we just heard in Megan's report, the FDA is considering approving that. So if both Moderna and J&J are approved by the CDC, then that would mean that there's this potential that you get a different type of shot, a different brand of shot, essentially, than the first 1 dose or 2 dose that you got. What do you think about that? What do you think about the confusion it may lead to? What's your kind of advice to people on how to handle this? And do you think it ultimately could encourage more people to get vaccinated?
Savannah, this is something that has been long anticipated. We've been mixing and matching vaccines in other countries, Canada, the UK, and Italy, with great success. Now the data pans out here in the US to show that there is a 76-fold increase with mixing and matching versus a 4-fold increase with using the same vaccine. So overall, there's a more robust immune response, which is a very wonderful piece of information. I think that there will be some hiccups along the way as we roll this out. But ultimately, for those 15 million Americans who have been vaccinated with Johnson & Johnson, this is a welcome piece of news and something we should really embrace.
So let's talk travel here for a minute, because the CDC is now saying that Singapore is one of the highest risk travel destinations for Americans. So if you're fully vaccinated, can you still travel to places that are assigned high risk, or would you advise against it?
So, Ellison, based on those, there's many countries that are in level 4, level 3. Personally, I would advise against it. What's interesting about Singapore right now is that it is an evolving situation. Like many countries, Singapore was a great success earlier on in the pandemic. They have an 84% vaccination rate, but over the past 28 days, we've seen record highs of COVID cases. So since it's an evolving situation, and Singapore recently has dropped its travel restrictions. So for those Americans who are traveling, please take all the necessary precautions. Please make sure that you are fully vaccinated, that you are masking, avoiding large crowds. And if you can avoid travel right now, that would be the safest bet.
Okay, Dr. Aditi Nerurkar, thank you so much for that.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.